My name is Lesley Stoyan. I am a 51-year-old Ontario resident, self-employed as a movement therapist and nutritionist. I am currently suffering from the devastating effects of post-acute sequelae of SARS-CoV-2 infection, more commonly known as long COVID. I became infected with the virus in December 2020 and was formally diagnosed in early January 2021. My acute illness was complicated, terrifying, and isolating, as I had to be physically removed from my special needs son for 14 days. I spent the entire time locked in my bedroom, listening to him cry outside my door, afraid that he would never get to see his mother again. At the time, I thought this was the worst it could get. I wish that was accurate. The last 22 months have been unbearable. Shortly after the acute symptoms subsided, I was plagued with a myriad of novel and equally as frightening symptoms: escalating heart rate and palpitations, dysphagia, an inability to properly process food, mast cell activation and histamine reactions, skin issues, hair loss, liver and gallbladder complications, neuralgia, involuntary muscle fasciculations, vertigo, tinnitus, and jaw and mouth issues resulting in expensive treatments and surgeries, over $10,000, none of which is covered by OHIP. Being self-employed and with mounting medical bills for both my own health issues and my son's autism needs, I do not have the luxury of taking time off work and do not have access to disability benefits. The care available in Ontario for long haulers with complicated portfolios like mine is scarce. The only clinics covered by OHIP are for those in need of significant respiratory rehabilitation, and that wait list is long. The research clinics, which I am currently enrolled in, are geared more towards using our patient profiles to learn from, rather than assist in helping treat our escalating symptoms. Private clinics for experimental body work charges on average $250 per visit. With many long haulers needing daily treatment, that adds up to over $5,000 a month, a cost not sustainable for 99% of Ontarians. The latest numbers show that 1.4 million Canadians are suffering with the devastating and life-altering effects of long COVID. That number is growing daily and estimated to be much higher given the lack of testing and reporting. On the Ontario government websites, there is no transparency about the number of residents suffering from long COVID, but it's easy to deduce that there are hundreds of thousands of people with a formal diagnosis and many, many more left to suffer alone. There are no supportive resources listed to help those afflicted, and shockingly, there is no plan mentioned on how to support the growing number of residents struggling with this devastating disease. I am fortunate to hold a health science degree and to be well versed in the areas of medicine, infectious disease, and chronic illness recovery. I am also a fierce advocate for my own health and well-being and for my loved ones. But not every Ontarian is as privileged as me, and many are struggling to even find a doctor to listen to them, let alone help find a treatment to ease their suffering. The Ontario government must do better and work with the Canadian government to be aligned with other countries like the United States, the UK, and Israel, who are leading the charge in the areas of research and medical treatment for long COVID. Doug Ford and his cabinet must prioritize the allocation of resources towards publicly funded treatment facilities and make them easily accessible to all Ontarians needing support with minimal wait times. The matter is urgent. The devastation of those suffering from long COVID is our next pandemic, one that the provincial government does not have the luxury of ignoring. If not, Ontario will no longer be a place to grow. It will be a place to die.